It usually starts at the end of a long, stressful day. You feel lonely, maybe a little anxious, or simply bored. So you open a private tab on your phone to get some quick relief, telling yourself it will only take a few minutes. But those few minutes stretch into a lost hour. Your sleep is delayed, your browser history is meticulously cleared, and another quiet promise to yourself is broken. Eventually, the screen powers down. But the pattern of behavior doesn't stay trapped inside the device. It follows you into your morning, into your focus at work, and into your relationships. The danger here comes from the gap between intention and action. The real question to ask is not whether someone looks at adult content occasionally. The question is whether the behavior has begun making choices for them. While the phrase porn addiction is everywhere online, you won't find it in the standard diagnostic manuals. Clinicians and researchers instead refer to problematic pornography use. They focus entirely on a person's agency, their ability to stop when they want to. Logging on frequently does not automatically mean you have a disorder. The defining marker of clinical compulsion is the persistent, repeated failure to control the behavior, even when it actively harms your daily life, your job, or your relationships. There is also a distinct psychological phenomenon called moral incongruence. This happens when a person's behavior conflicts with their deep-seated religious or personal values. That conflict creates immense distress and guilt. But experiencing distress purely because of moral disapproval does not equal a clinical compulsion. If we map this out, you can see how these factors separate. High frequency and moral disapproval overlap heavily, but clinical compulsion sits in this third category. That pulsing circle, loss of control and real-world harm, is exactly where character erosion begins. To truly understand how this habit impacts your life, you have to set aside shame and moral panic. Evaluating the behavior strictly through the lens of personal control is the only scientifically valid way to see what it is actually doing to you. Online pornography operates in a highly specific environment. It combines absolute privacy with immediate speed and a virtually unlimited supply of novelty. This environment turns a digital screen into a hyper-efficient escape and reward loop. It creates a frictionless mechanism perfectly designed to help the human brain bypass negative emotions. This diagram shows exactly how the compulsion builds. The cycle starts with a trigger, a spike in stress, loneliness, or boredom. That uncomfortable feeling instantly sparks an urge, driving the brain into a frantic search for novelty and distraction. You get a brief flash of relief, but the crash happens rapidly. That relief sours into guilt and secrecy, which loops right back around and generates more baseline stress than you started with. The paradox is that this repetitive cycle is rarely driven by pure sexual desire. It is a maladaptive psychological tool. People use the behavior to regulate uncomfortable feelings they don't want to sit with. By using this shortcut to feel temporary relief, a person unwittingly reinforces a rigid neurological pathway. The attempt to feel in control leaves them with less actual freedom and significantly higher anxiety. Character is not a static trait you are born with. It is an active ability to act according to your chosen values. It operates exactly like a muscle. It requires consistent practice. When you repeatedly tell yourself, "This is the last time," and then immediately break that promise, you degrade your own self-trust. Over months and years, that widening gap between intention and action systematically destroys personal discipline. The necessity of hiding the habit also exacts a heavy toll on honesty. Covering your tracks every day trains your brain to default to half-truths, deleted histories, and emotional distance. Every time you choose emotional avoidance, you deprive your brain of essential practice. Retreating to a screen means you lose reps in tolerating discomfort, handling conflict, and solving the messy, unresolved problems piling up in the real world. Over time, an intense preoccupation with scripted, high-novelty digital content can begin to replace vulnerable human communication. It creates a dynamic where romantic partners are viewed through a lens of objectification and unrealistic expectations. A private digital habit rarely stays private. The inability to follow through on your own intentions inevitably spills over, quietly reshaping your public reliability and the quality of your closest relationships. Struggling with a compulsive pattern of emotional avoidance does not mean your character is permanently damaged. It doesn't erase your identity or your dignity. Because character is practiced through repeated daily choices, those neural pathways remain highly adaptable. Establishing new, honest routines will successfully override the old compulsive defaults. The required first step is dropping the burden of moral panic. Once you recognize your loss of control as a mechanical, habitual process, you can actively begin closing the gap between your intentions and your actions. A successful reset starts with objectively defining the actual problem. You track the exact triggers, the time lost, and the concrete consequences in your life, totally separating the data from moral shame. Next, you have to add physical friction to your digital devices. The internet moves too fast for willpower alone. You need to use filters, move screens out of private spaces, and physically interrupt immediate access. When a rapid urge hits a physical barrier, it forces a pause, creating a critical window to interrupt an automatic impulse. Inside that space, you identify the emotion you're trying to numb, like stress, and substitute screen time with a targeted, healthy coping mechanism. Step 4 focuses on repairing integrity. You rebuild a baseline of self-trust by making small, highly realistic daily commitments and proving to yourself that you can actually keep them. Finally, if the loss of control remains severe, it is entirely normal to seek professional, evidence-based help. Licensed therapists using techniques like cognitive behavioral therapy can address the deeper anxiety or trauma feeding the loop. Recovery truly begins the moment secrecy transforms into honesty. Your character isn't defined by the traps you fall into. It is shaped by the courageous, conscious choices you make to reclaim your own agency.